Hello everyone, welcome back to the Excel MRB orientation classes. Myself Mohammed Naushad, I am working as an associate professor in the Excel College of Physiotherapy. I have completed my bachelor's of physiotherapy from Excel College of Physiotherapy. Okay. Past three classes we have seen about like electrotherapy and Tamil classes. Today we have a small orientation class about anatomy, the important topics of anatomy. So today I'm going to discuss about two fluxes, brachial fluxus and lumbar fluxus. As we know, fluxus means a network of nerves or a vessels. In our body, we have totally four major fluxes: cervical fluxus, lumbar fluxus, sacral fluxus, and brachial fluxus. In this class, we are going to discuss or concentrate on two major fluxes, that is brachial fluxus and lumbar fluxus. First, I'll be giving an intro about the parts of the brachial fluxus. Then we'll discuss about the uh, multiple choice questions with answers and explanation. Let's move on to topics. So as we were saying, fluxes are the network of nerves. Generally, just imagine a tree. Tree has many parts, including roots of the tree, trunk of the tree, branches, cords, all those divisions. Likewise, in the brachial fluxus, we also have these kind of things. We have roots, trunk, branches, then the cords. So roots are like C5, C6, C7, C8, and T1. These are the roots of the brachial fluxus. Here, C5 root and C6 root. Here, C5 root and C6 roots combine together, and C1 comes alone. Whereas, like C8 and T1 combines together. Now, we were seeing the roots. After the roots, we'll have, when these two roots or these two roots combines together to form trunks: upper trunk, middle trunk, and lower trunk. After the trunk, there will be a divisions. Each trunk has two divisions: anterior division as well as posterior division. See, this is anterior division of the upper trunk, posterior division of the upper trunk, anterior division, posterior division, anterior division, posterior division. This is anterior division, posterior division, whereas this is upper trunk, middle trunk, and lower trunk. These are the roots. Now, after the divisions, there should be a part called cords. Generally, we have three cords. These cords are formed by the combination of the anterior and posterior divisions of the trunks. First cord name is lateral cord. Okay, a lateral cord forms the anterior division of upper trunk and the anterior division of middle trunk. Then we have medial trunk, medial cord. This is formed with the anterior division of lateral cord alone. Now, last cord is like posterior cord. Posterior cord is formed from all the posterior division of all the trunks, like posterior division of upper trunk, posterior division of middle trunk, posterior division of lateral trunk. This is lateral cord, middle cord. This should be posterior cord. As we seen, this was roots, then these were trunks, and these were divisions. These were cords. Next, the most important parts are the branches. Each cord has several branches. We'll discuss them simultaneously. I have some mnemonics to have these kind of things. First, lateral cord gives totally 3 branches. I have denoted them as L, M, L. That is love me lot. Then middle cord has 5 branches. We can remember as M for U. M1, M2, M3, then M4. Totally 4. Then we have U. Lastly, posterior cord gives again 5 branches. We can remember this as ulnar. U, L, A, N, R. Now, till now I have given only the mnemonics. I'll elaborate what is the mnemonics things. This is L stands, that is love me lot. Love starts for lateral pectoral nerve, and M stands for musculocutaneous nerve. Musculocutaneous nerve. Then last L, that is love me lot, stands for lateral root of the median nerve. Totally, we have median nerve. Totally, we have these 3 nerves, which are L stands for lateral pectoral nerve, M stands for musculocutaneous nerve, then last L stands for lateral root of median nerve. Now, second, we'll move on the second branches of the medial cord. It has 4 things. M4 and U. M stands for, here we have seen lateral pectoral nerve. If there is lateral pectoral nerve, automatically there should be a median pectoral nerve. So here it starts median pectoral nerve. Then here we have lateral root of median nerve. When we have lateral root of median nerve, we should have lateral medial root of median nerve. This is medial root of the median nerve. Remaining 2, they are like the medial cutaneous nerve of arm and medial cutaneous nerve of forearm. That is medial cutaneous nerve of arm, then medial cutaneous nerve of forearm. Lastly, we have ulnar nerve. Ulnar nerve. Then moving to the posterior cord, again we have some branches. We'll name them. First U stands for upper subscapular nerve. Then L stands for lower subscapular nerve. Then N stands for nerve to latissimus dorsi. A stands for axillary nerve. Axillary nerve. Then last, finally, R stands for radial nerve. Radial nerve. These were the branches from the cords. Once again, I'll say them. Okay. Like these were the top branches. Now we'll go to the quiz session. Okay. First question. The brachial plexus is formed by the ventral rami of which spinal nerves? First option is C1 to C4, C5 to T1. Third option is T2 to T12, and fourth option is L1 to L5. Just a glance we'll discuss. Okay. Thank you. Everyone has tried to answer your question. Sharmila BT, thank you. Answer. We'll go to the answer session. Answer is option B, C1 to C5. As we know, the ventral rami of C5 to T1 is a brachial plexus nerve root. Then we'll go to the second question. Which of the following is a common injury associated with brachial plexus? I have given four options. That is carpal tunnel syndrome, Erb's palsy, tennis elbow, and rotator cuff tear. Among these four, which is associated with brachial plexus injury? Just have a glance for 3 seconds. We'll see. Answer. Okay, Mr. Savanan Kumar, you have answered a correct answer. Answer is Erb's palsy. Erb's palsy is a common injury associated with the brachial plexus injury. How? Where? Generally, nerve root of C5 and C6 combines to form upper trunk. In upper trunk, again, it is going to divide as anterior division and the posterior division. In the upper trunk, we have two nerves, that is subscapularis nerve and subclavian nerve, suprascapularis nerve and subclavius nerve. This is a common point where all the nerves are forming. If in this particular point is called as Erb's point. When there is an injury to the particular Erb's point, we can it can be result as Erb's palsy. Moving to the next question. Okay. The upper trunk of brachial plexus is formed by the which of the spinal nerves? The upper trunk, as we have seen, there are three trunks. Among upper trunk is formed by which nerve root? Option A, C5 and C6. Option B, C7, C8. Option C, C8 and T1. And option D, C4 to C5. Have a glance. We'll be back. Okay. Coming to the answer. Answer is C1, C5 to C6. These are the two upper cords, nerve roots, which are forming the upper cross of brachial plexus. Thank you, Dr. Vlogs. We have answered a correct answer. Moving to the next question. Which muscle is primarily innervated by the musculocutaneous nerve? The nerve, which is called as musculocutaneous nerve, which muscle is primarily innervated by that nerve? Option A, biceps brachii. Option B, triceps brachii. Option C, deltoid muscle. And option D, pectoralis major. Have a glance, we'll be back. Okay. Thank you, Mr. Jaikumar. Brachii is a primary muscle which is innervated by the musculocutaneous nerve. And here you can see option B is triceps brachii. Which muscle, which nerve is innervated by this? Can anyone comment? Have this thing. Which nerve is innervated by the triceps brachii? In this question, I have asked about musculocutaneous nerve. They can even ask among these muscles, nerves also. Answer, please. Have a glance. Yes, Arundhati, thank you. You have answered correct answer. For the triceps brachii is supplied by the radial nerve when it is present in the posterior compartment. Deltoid is supplied by the axillary nerve. Next question. Going to the next question. The median nerve is responsible for the innervating which of the following function, particularly to the median nerve, which function it is doing. Option A, flexion of elbow, abduction of shoulder, flexion of wrist and fingers, then extension of the wrist. Have a glance. Please comment your answers. Okay, 3 seconds over, guys. We'll see the answer. Mr. Ganesh Murthy, you have answered a correct answer. Option C is the right answer. The flexion of wrist and the fingers. The median nerve is innervated most of the flexus muscles of the forearm and some intrinsic muscles of the hand too. Moving to the next question. Which of the following condition can be result from the traction injury of brachial plexus? There are many type of injuries. I am particularly asking about traction injury of brachial plexus. Option A, thoracic outlet syndrome. Option B, Kamsky palsy. Option C, frozen shoulder. And option D, impingement syndrome. Have a glance. We'll come to answer. Okay, many people have answered for this question, like Mr. Saran Raj, Amu, Hemalata PT. Thank you so much for your participation. Answer is Kamsky palsy. It's the most common type of traction injury seen in the brachial plexus. Moving to the next question. The radial nerve primarily innervated which of the part of the arm? Which part of the arm? Radial nerve. Option is anterior compartment. Option B is posterior compartment. Option C is medial compartment. And option D is radial compartment. Have a glance of 3 seconds. We'll be back. Okay. Miss Kalai Selvi and Miss Sri Devi have answered correct answer. We see the answer. Answer C. Posterior compartment is supplied by the radial nerve. Remaining things, anterior compartment of the arm is supplied by musculocutaneous nerve. Option B, we have seen radial nerve, and medial compartment is supplied by medial cutaneous nerve of the arm, and option D, lateral compartment is supplied by lateral cutaneous nerve of arm. I hope I am very clear. Okay, moving to the 8th question. Which of the following test is commonly used to assess brachial plexus injury? I have given 4 options. First option is Farins test. Option B is Snell's test. Option C is Adson's test. Option D is Sperling's test. Have a glance. I'll be back. Okay, I hope you have answered. Miss Nagma, you have answered correct question. I'll go to the answer session. Option D is correct answer. Sperling's test. The position is like patient has to be sit, neck has to be extended, then we has to rotate on this same area, same side. Then we have to apply little compression to the head. Well, applying to the compression, if patient feels pain in the same side, then this test is positive. If this test is positive, this indicates there is a brachial plexus injury. Moving on. Okay, moving on, the long thoracic nerve, a branch of brachial plexus, innervated which muscle? There is a nerve called long thoracic nerve in the brachial plexus. It has to innervate a muscle. I have given 4 options. Which muscle is going to innervate? Option A, serratus anterior. Option B, pectoralis minor. Option C, subscapularis. And option D, rhomboides. Have a glance. Yeah, thank you for the great response. Thank you, Miss Vijay Lakshmi and Miss Saranya. You have answered correct answer. Answer is the serratus anterior muscle. What about the remaining muscles? Which nerves are they supplying? Going to the pectoralis minor, it is supplied by upper, uh, lateral and medial pectoral nerves. Whereas subscapularis, it is supplied by subscapularis nerve. And rhomboides muscle is supplied by nerve of subclavius. Moving to the 10th question of brachial plexus, which of the following is not a branch of posterior cord of brachial plexus? We have given 3 cords like lateral cord, medial cord, and posterior cord. Last cord is posterior cord. Which of the part is not a branch of posterior cord? Option A, axillary nerve. Option B, radial nerve. Option C, thoracodorsal nerve. Option D is median nerve. Have a gland, we'll be back. Okay, let's have a glance on answer. Answer is median nerve. Generally, as we say, like posterior cord, lastly, I have given 4 types. That was like ulnar. It was like upper subscapularis nerve, lower subscapularis nerve, then nerve to latissimus dorsi, and axillary nerve. Then it was about radial nerve. Here we see we have like axillary nerve, radial nerve. These two considered as thoracodorsal nerves, but here we don't consider median nerve. Median nerve is a branch of lateral and medial cords. Okay. Till now we have seen about the brachial plexus and we have jumped into the MCQs. Now we'll go to the lumbar plexus. We'll have glance about the lumbar plexus. Before going to the particular plexus, let's have a gland about a spinal cord. Imagine this. Sorry for the interruption. Imagine this as spinal cord. Okay. Here we have posterior horn cells and here we have anterior horn cells. From the posterior horn cells, a nerve root is going to arise, whereas same in the anterior horn cells, a nerve root is going to arise. Those nerve roots comes forward and combines together to form spinal nerves. Again, these spinal nerves further divides into posterior rami and anterior rami. Like we were discussing the ventral rami of C5 to C6 in lumbar, like in brachial plexus, whereas all these things are going to divide like this. Again, this anterior and posterior rami further divides into some branches. That is called as anterior branch and posterior branch. Keep in this mind, like we are seeing anterior rami has again divided into two branches, anterior branch and the posterior branch. Why I have said this, I'll say in like coming thing. Now, lumbar plexus has nerve root of L1, L2, L3 and L4. And also additionally we have L5. Additionally we have L5. Here this plexus, as I say, it also starts from anterior rami only. Again, I have said it has two parts, anterior division and posterior division. So consider we are discussing now about anterior division. Then we will discuss about posterior division. Now, anterior division give rise, L1 alone give rise to nerves. That is ilio hypogastric nerve, first branch. Then second branch is ilio inguinal nerve. Now again this L2 give rise with a combination of L1, the combination of L1 nerve root and the L2 nerve root combines together to form a nerve called genitofemoral nerve. Genitofemoral nerve. Further, they can divide into again two branches, genital branch and femoral branch. Now again, the nerve root C5, L2, L3 and L4 combines together to form a nerve called as obturator nerve. Obturator nerve. This nerve is particularly seen in anterior division. Now, combination of L4 and L5 give rise to a trunk called as lumbosacral trunk. This was all about the anterior division of lumbar plexus. I'll repeat, anterior division, L1 alone give rise to the two nerves, ilio-hypogastric nerve, ilio-inguinal nerve. Then L2 with a combination or a combination of L1 give rise to a nerve called as genitofemoral nerve. Then combination of L2, L3, L4 give rise to a nerve called as obturator nerve. Last, finally, combination of L4 and L5 give rise to a trunk called as lumbosacral trunk. This was all about the anterior division. We'll go to the posterior division. Posterior division has same wise combination of L2, L3 and L4 give rise to a nerve called femoral nerve. Nerve called as femoral nerve. You might get confused. Here I have already said like L2, L3, L4 give rise to the obturator nerve. Again I am saying L2, L3, L4 is giving to the femoral nerve. The major difference is it is anterior division of anterior rami. This is posterior division of posterior rami. Next, combination of L2 and L3 give rise to the lateral cutaneous nerve of the thigh. Lateral cutaneous nerve of the thigh. These were the branches, these were the nerves of the lumbar plexus. I hope I am clear. Now we'll jump into the quiz. Okay. Okay. Let's go to the lumbar plexus quiz. First question, that is 11th question. Which of the following muscle is primarily innervated by femoral nerve? Femoral nerve is innervated by which of the muscles? Option A is adductor longus. Option B is quadriceps femoris. Option C is gracilis. Option C is pectinis. Have a glance. We'll be back. We'll be back. Thank you, Hemashri, Sarvana Kumar. All you have answered correct. Option is option B, quadriceps femoris. The name has quadriceps femoris. Femoris means femoral. So for the explanation, the femoral nerve is a major branch of lumbar plexus, primarily innervated the anterior compartment of the thigh, which includes quadriceps femoris. Femoral nerve supplies the anterior compartment. In the anterior compartment, we have like quadriceps muscle. The quadriceps femoris is responsible for the knee extension. Apart from this, adductor longus muscle and gracilis are innervated by the obturator nerve, whereas pectinis is innervated by the pectinis muscle is bothly innervated by the femoral nerve as well as obturator nerve. I hope I am clear. This muscle is only innervated by femoral nerve, obturator nerve, and gracilis is also innervated by obturator nerve. Quadriceps femoris is innervated by femoris nerve. Pectinis is innervated by both obturator as well as femoris nerve. Moving to the next question. The ilioinguinal nerve is primarily responsible for the sensation involved to which of the following area? The first part, the ilioinguinal nerve is responsible for the sensation of which part of the area? Options: anterior thigh. Option B is middle thigh. Option C is skin of the groin and upper middle thigh. And option D is lateral aspect of thigh. Have a glance. We'll be back. Okay. Pavitra, you have answered correct answer. We'll go to the answer session. Okay. Answer was option C, the skin of groin and the upper middle thigh. If you see, the iliolingual nerve is a major branch of the lumbar plexus, provide the sensory innervation of the skin on the groin and the upper thigh. It also supplies some of the abdominal muscle. It doesn't supply only the groin and the upper thigh. It also supplies some of the muscles of abdominal muscles, whereas it does not involve the anterior or middle thigh, which are primarily innervated by the femoral and obturator nerve. Inguinal has innervated only on the skin and the upper thigh and abdominal. Remaining things, anterior thigh and middle thigh, are innervated by the femoral nerve as well as obturator nerve. Moving to the next question. The question is, the ilioinguinal nerve Next question is, which of the following statement about the lumbar plexus is true? Which of the following statement of lumbar plexus is true? Option A, it is formed by the anterior rami of T12 to L3 spinal nerves. Option B, it primarily innervate the upper limb. Option C, it gives rise to the sciatic nerve. And option D, it is located within the psoas major muscle. Saying which statement among these four options is incorrect about lumbar plexus. Have a glance, we'll be back. Okay. Your correct answer is option D. It is located within the psoas major muscle. As we say, like T12 to L3, it doesn't consider, like it's a wrong answer. Then it primarily invades the upper limb. Of course, lumbar plexus comes in the normal lower limb, not in the upper limb. This is also a wrong answer. It gives rise, option third is, it gives rise to the sciatic nerve. There is no nerve coming in the lumbar plexus. Sciatic nerve comes under the sacral plexus. So this is also a wrong answer. So major answer will be, it is located within the psoas major muscle, where the nerve emerges from the anterior rami of L1 to L4. Next question, which of the following nerve can be affected in a herniated lumbar disc at L3, L4 level? Question, which of the following nerves can be affected in a herniated disc, lumbar disc at the level of L3 to L4? Option A is femoral nerve. Option B is obturator nerve. Option C is sciatic nerve. Option D is all of the above. Have a glance, we'll be back. Jaya, Chitra, Bhavya, Kesavan, you have answered correct answer. We'll go to the answer session. Answer is femoral nerve. Okay. Correct answer is femoral nerve. Explanation, a herniated lumbar disc at the level of L3 to L4 level can be potentially affect the femoral nerve, which arises from the lumbar plexus at the level of L2 to L4. The obturator nerve could also be affected because the femoral nerve and the obturator nerve has same nerve roots. As I said before, the anterior division and the posterior division has same nerve roots, but majorly compared to the obturator nerve, femoral nerve is going to affect. Moving to the next question. The genitofemoral nerve is responsible for. The genitofemoral nerve is responsible for what? Option A, motor innervation to the iliopsoas muscle. Option B, sensory innervation to the skin of scrotum and labia and the upper thigh. Option C is a motor innervation of quadriceps muscle. Option D, sensory innervation to the medial thigh. Have a glance, we'll be back. Okay. Thank you, Sona, Nasreen, and Pavitra. You have answered correct answer. We'll go to the answer session. That is option B. That is option B. Sensory innervation to the skin of the scrotum and the labia of the upper thigh. It supplies, as name says, genito. It means genitals. We are speaking about the genitals. genitofemoral. If you see the explanation, the genitofemoral as a branch of lumbar plexus has two main branches. I given in the introduction, it further divides two branches. Genitofemoral divides into two branches, genital branch and femoral branch. Give rise to supply the skin of the scrotum in the male and the labia in the female. And femoral branch, the second branch is femoral branch. It supplies the upper thigh. As we have seen, genito gives males, it goes to the scrotum. In females, go to the labia. Second part is femoral. Femoral nerve goes and supplies to the upper thigh. Moving to the next. A patient present with the weakness in hip adduction of loss over the middle thigh. Which nerve is mostly likely to be affected? We are seeing the weakness of the hip adduction. If we are not able to do hip adduction, which nerve is affected? Option A, femoral nerve. Option B, obturator nerve. Option C, sciatic nerve. And option D, lateral femoral cutaneous nerve. Have a glance. We'll join you soon. Thank you for your patience and coordination, Miss Sabia, Miss Sona Nasreen. Again, you have answered correct answer. Option is option B, obturator nerve. This is correct answer because the obturator nerve is responsible for the innervation of adductor muscles of the thigh. If there is weakness, if a patient is not able to do adduction of hip, we have to think which muscle is going to do adduction, which nerve is going to happen. Of course, obturator nerve is responsible for the adduction of the hip. And normally, femoral nerve is responsible for the innervated the anterior thigh, and sciatic nerve innervate the posterior thigh. Anterior thigh is going to innervated by the femoral nerve. Posteriorly, it's going to innervated by the sciatic nerve. Lateral femoral cutaneous nerve is innervated by the lateral thigh. As name indicates, lateral. So it should be innervated by the lateral thigh. This is anterior. This is posterior. Moving to the next question. Which of the following is a common clinical manifestation of lumbar plexus injury? Which of the following is commonly clinical manifestation? Option A is inability to flex the knee. Option B, inability to extend the extend the hip. Option C, inability to adduct the thigh. And option D is inability to dorsiflex the foot. Have a glance, we'll be back. Let's move on to the answer session. Answer is inability to adduct the thigh. Option C is the correct answer. Injury to the lumbar plexus particularly affects the obturator nerve. Just now we have speak about the obturator nerve. It was not able to do hip adduction, right? Whereas like here, obturator nerve can lead to inability to adduct the thigh due to paralysis of adductor muscles. So commonly, if we see, lumbar plexus will have difficulty or inability to adduct the thigh if it gets any kind of injury. Inability to flex the knee is typically associated with femoral nerve. Inability to flex the knee is typically associated with femoral nerve, and whereas inability to extend the hip associated with sciatic nerve. If sciatic nerve get injured, they will be not able to extend the hip. If femoral nerve get injured, they will be not able to flex the knee. The next, inability to dorsiflex is associated with common peroneal nerve, that is foot drop. I hope I'm clear with this. Once again, I'll repeat this. Inability to flex the knee will be associated if there is injury to the femoral nerve. Inability to extend the hip will be associated with the injury of sciatic nerve. Inability to adduct the thigh will be associated with the injury of which nerve? Commonly obturator nerve. It is obturator nerve. Inability to dorsiflex the foot will be associated with common peroneal nerve. Moving to the next question. A patient present with a loss of sensation in the anterior compartment, inability to extend the knee, which nerve is mostly likely to be injured? Answer option A is obturator nerve, option B is femoral nerve, option C is sciatic nerve, option D is lateral cutaneous nerve. If you have noticed, if you have concentratedly observed my class, you'll be able to answer this question, because in previous answer there was a question of this. Have a 2 seconds glance. Okay, thank you for your patience. We'll have the answer session. That is femoral nerve. Already I have explained this. Anterior compartment will be supplied by the femoral nerve. Answer is femoral nerve. Femoral nerve supplies the quadriceps muscle. Then it will be helping for the knee extension. Moving to the last question of session. Which of the following statement about the lumbar plexus is correct? It is option A. It is formed by the anterior rami of L1 to L4 spinal nerves. Option B. It provides motor innervation to the lower limb. Option D. It is located in the pelvis. Option D. It gives rise to the femoral and obturator nerve. Once again, which of the following statement about lumbar plexus is incorrect? Option A, it is formed by the anterior rami of L1 to L4 spinal nerves. Option B, it gives motor innervation in the lower limb. Option C, it lies located inside the pelvis. And option D, it gives rise to the femoral and obturator nerve. So, please say me the answer as the last question. Okay, finally to the answer session. Thank you, Mr. Manikandan, Hemalata, and Kalai. You have answered correct answer. Option is it is located inside, located in the pelvis. The lumbar plexus is located in the posterior abdominal wall, not inside the pelvis. So remaining all three options are correct. Generally, it is formed by the anterior rami of L1 to L4 spinal nerve, and it invades the motor innervation of lower limb. It gives rise to the femoral as well as obturator nerve, right? Only the answer which is not correct is it is located inside, in the pelvis. These were the these were some session and answers. Thank you for the valuable time and patience. Thank you so much. If you have any kind of queries and doubts, you can contact us. We have given email ID in our MRP group channel. For honor public demands, like behalf of the public demands, you have asked us. We have scheduled a lengthy of classes, but on public demand, tomorrow again we are going to consider your demands, and we are going to give a class on Tamil by Professor Ranjana on the public demand. So thank you for the valuable patience. Thank you for the valuable patience. I'll have an email. I'll write an email address. Please copy down. That's principal E copy @ That is principalecopy@excelcolleges.com. If you have any queries or any kind of doubts, any suggestions regarding how we can improve our session classes or any kind of doubts, you can contact us. Thank you. Have a wonderful day. Thank you so much.